This is Average Joe PT, where we're here to reduce your pain, reduce anxiety through education, and improve your function through physical therapy and fitness. Now today we're going to talk about good old Mr. and Mrs. Disc, bulge, herniation, rupture, fragmentation. What all those terms mean, we're going to go over that today, as well as give you some treatment ideas to help reduce your disc issue. Stay tuned, here we go. All right, let's talk about the disc. Now, it's gelatinous type filling, and it essentially gives the cushion or support between the bones of your spine. So this being the front, and this being the back, this being the spinal cord, and then these little things off to the sides being the nerves that can get irritated. So if you're having a disc issue, it's usually going to be on the back and outside. So whether it's pushing back or back and to the side, you're going to get some irritation in the nerve on either side of the body. Now, the idea years ago was that the disc is somehow going to push out and come back in. Well, the reality is once it's kind of pushed out, it leaks, it gives off some what we call inflammatory chemicals that gets that nerve on the inside really irritated. And so what you want to do is initially put yourself in a nice rested position that we'll go over. Stay tuned for that, as well as some of the exercises I'm going to point up above. After the inflammation starts to reduce after 2 or 3 days, I'm going to give you a little link above that you can look at that can give you some idea of some of those muscles that can go into spasm and get irritated after the disc has caused some of the issue in the first place. So that's a little tidbit for you. After you're done with this video, you can go look at that one. Now, this disc itself, as it starts to bulge out, basically there's nerve endings only on the outside. The disc itself does not have any nerve endings. So you could have multiple tears within the ring of the disc and not have any symptoms because there's no nerves there until it gets and starts to push out on what we call the peripheral nerve, or out to the side, one of these side nerves that comes out from the spinal cord. And then you're going to have an issue. That's, at that point, it's a herniation. As I talked in the very beginning, you can have that bulge which just pushes out. It might touch the nerve, it might not. The herniation is going to touch the nerve. And then we're dealing with a rupture where some of the disc, the fluid itself is leaked out into the space, into where my finger's at, into the canal, and or it fragment. Basically a piece of it's broken off and it's just floating inside there. Any of those last two, if they give you an MRI or an MRI with dye, which is called contrast, they're probably going to have to do surgery to get that if it's fragmented out. But that not being the case, there's some treatment exercises you're going to do at home to help reduce one of these three issues that we're talking about: the bulge, the herniation, or the rupture. Fragmentation, you're not going to have probably physical therapy for that. You're probably going to go right in for surgery to take that fragmentation out. Now you can leave comments down below if you want to talk about the type of surgery that I've had, a laminectomy or some other discectomy, so those types of terms that get thrown out there. You can leave a comment down below and I can discuss that offline, or I can discuss that in another video if you want me to. But give you these three actual exercises you can do at home once you realize you're having some disc issues, which is usually pain down the side of the leg that passes the knee joint on either side. That's a clear case that you're having a bulge issue. Now there's some tests you can do. We're not going to go over that. Just be certain if you're having pain down, numbness, or burning down one of the legs that passes the knee joint, or along the back side of the thigh down in behind the knee joint area, coming into the back of the hip, it's probably coming from a nerve. So I'm going to give you some exercises. Stay tuned. This is the most important part coming up. Be right back. Exercise number 1. The best position you can put yourself in is not sitting. The best position you can put yourself in is either lying on your side, lying on your back, or lying on your stomach for short periods of time to limit sitting position completely. So if you're lying on your stomach, which is very important, what you want to do is take a pillow, take some ice, put that right underneath the belly button and throw the ice right over the top of the lower back and whatever side's bothering you. You're going to lie in this position for a good 10, 15, 20 minutes, and you're going to do that 3 or 4 times a day. Do this as long as those leg symptoms are improving. Now, another one you could do is do the ice lying on your side. Put a pillow. I always like to be against the wall, if you can do that, or put a pillow behind your back, and then just put that ice right over the top. Let's just say it's the right leg that's giving you the nerve pain. Literally just put it right on that side. Ice is your friend. Don't do heat. Heat actually speeds up the nerve. That's the last thing you want to do, is heat something when you're having neuropathic or disc issues. That's inflamed. You don't want to inflate it more with more heat. So ice, pillow, position. Like I said, you could be on your back. Take a cushion, put your legs right over the top, and be like this. Now, some people talk about putting pillows underneath the legs. This, if you can find something that's a little firmer, like an ottoman or a stool or something that's not going to give it all, that's nice and firm, or put your legs on top of a chair, essentially in this position. Now, you don't want to sleep like this a long time, but boy, this can give you a lot of good comfort. Something as simple as that when you're having disc nerve issues down the side of the leg. Like I said, you're always limiting sitting. Sitting is the worst pressure that you can put on the disc, even if it's proper sitting. Now, proper sitting, you're going to use good old magic towel. You've seen in my other videos, you just roll up a piece of either a rag, or I don't want anything too thick, and you're just going to put some tape around it while it's rolled up, the magic towel. And essentially what you're doing is, when you're sitting, you're staying away from the slump. You're coming up nice and tall, and you're going to put that towel roll down at the tailbone so it blocks you from rolling down. All right? So that's the best thing you can do in position-wise, lying on your back, lying on your stomach, or lying on your side against a wall or pillows behind you so you don't feel like you're rolling back with ice. 3-4 times a day, 15-20 minutes at a time. Limit your sitting. You're going to do this faithfully for at least 72 hours. Get that inflammation to calm down. And then if it doesn't, that's immediate. You need to go see your doctor. You probably should see your doctor anyways if you're having some disc issues or just nerve pain down the leg, just to make sure that it's what we call mechanical. But this would be really good for that. So that is the positions that I would put you in and what you should be put in to reduce your disc issues. Now, simple exercise you want to start doing after 72 hours is doing more lying on your stomach, staying out of that, what I call letter C of the spine. Maybe take the pillow out and just lie in your stomach. Come up on your elbows. Maybe hold that position for about 10 to 15 seconds, then come down, relax. Now, this should basically make the symptoms, if you have any leg symptoms, should make them reduce. It should not increase your leg symptoms. You might have increased lower back pressure and pain, but you should have reduced leg symptoms doing this exercise. If you don't, stop immediately. Definitely go and see the doctor. But this position, I want you to hold for 10, 15 seconds, come down flat, come back up and repeat for a good 10, 15 times. If that feels pretty good, you can come and start to do like a half press up. Come up and hold for a second, and then come down, relax, and then come back up. Now, this is a little advancement for you. This is a big one. If your symptoms, let's say they're on your right leg, I want you to do this position, or if it's on your left leg, you'll do the opposite side. So let's just pretend this is on your right side. You're going to be on your stomach, but you're going to shift to the right. So your leg stays straight and your trunk moves, and then you come up. Hold this position for about 5 to 10 seconds, and then come down, relax, and then come up and repeat. Now, this position is if your leg symptoms don't go away being straight on. Now, if you shift to the right and your leg symptoms gets worse, that's also immediate. Stop doing it. It's enough. You need to follow up with your doctor. But one of these two positions, I want you to try them for a day or so with the ice and see if your symptoms improve. If they don't, that's a clear sign you need to go back. So those are some good exercises that you can do to help reduce your disc symptoms in your leg. Now you should notice a difference by doing these 3 to 4 days. Each day your leg symptoms should be getting better and better. But you might have some more back pain, but your leg symptoms should be resolving, and all you have is where the pain started from, which is at your lower spine. So leave some comments down below. If you have any questions, like I always say, if you like the content, I'd love to have you subscribe and ring the call bell down below so you can see my upcoming videos. I'm going to be making a few over the next few days since I was on vacation. And next time, I want you to look up and keep smiling.